we're here to talk together about the Heart of Medicine gathering next year in Central Australia. I wonder if you could tell our audience a little bit about the work you do as a doctor here in Melbourne.
Yeah, so I've been practicing medicine for over 25 years. And my special interest is in mind-body medicine and psychological medicine, and which lends itself obviously really well to mental health, women's health, but also that link between a lot of the functional, conditions like irritable bowel, chronic headaches, fatigue, hormonal dysregulation. And so I guess I use a whole person approach to really help people to understand what's going on in their bodies and their minds and how it all connects together.
We're so lucky to have you in the team. I'm really excited to be in the conversations with you. You wrote a really beautiful book, Michelle, The Wonder Within, which came out a couple of years ago now. The time really flies. About really detailing your experiences, but also offering lots of generous resources and so on for what other people can do if they feel overwhelmed or stressed, and about tapping into that our inner capacity, what we have within ourselves. And so I'm wondering if you can tell us a little bit about, I guess something about that journey and what resonates with you in the work that you're doing and the journey you're with the Heart of Medicine event next year.
Yeah, so The Wonder Within is really about getting people to understand the internal resources that they have and how the body has this enormous capacity to heal itself, and almost through, illness or difficulty is where we grow. And I guess the book kind of almost came through me after a huge kind of journey from setting up a business and selling a business, through the times of COVID and obviously all of my other roles in life, mother and partner and community person. And, I guess, in hindsight, experienced burnout and quite a lot of compassion fatigue. And I felt a real emptiness of my empathy. And that really troubled me. It's very difficult to practice medicine without a whole lot of empathy. And I think throughout my whole medicine career, I really loved the human aspect of medicine, the connection with people and the conversations and the, and the narrative that happens when people have, a relationship to their health and to their life. And I came across a quote many, many years ago it's a Japanese quote that says, "Life is medicine and medicine is life." And I pondered that for years in terms of what, that means. But I mean, I guess in medical school and the way modern medicine is practiced, there's a real devoid of that depth. And when I experienced, burnout, particularly in the context of medicine, and that was alongside me knowing so much about the internal mechanisms of my own healthcare. But there's one thing to know it, and then there's another thing to do it and to live by it and to practice it. And so I guess really the journey that I experienced was like, how do I get myself on my own platter of my life? Because I was always, and I think we're taught as a doctor to remove ourselves from the equation of care, and that the care is always delivered externally towards the patient. But because I wasn't caring enough for myself, that led to my own demise, and the impact then rolled on to the patient. So, I mean, this is how we connected as well, this real intensity and integrity and importance of the care of the person delivering the care. And that is also akin to things like, motherhood and all those other caring professions, teaching, education, all of the allied, but even legal, a lot of lawyers are doing deep caring work, and they're touching deep humanity and deep human psyche. And I think we have to change the conversation towards this understanding of how we care for ourselves. And I was talking to somebody the other day and talking about protected time, like protecting our time from all of the other things that, we need to do. And, when I was growing up and like when you were growing up, we didn't have to protect our time because our community protected our time. So our Sundays were protected, our evenings were protected, our Saturday afternoons were protected. But now we have no protected time. So we have to learn a new skill to protect it. Anyway, back to the book. So this whole journey of I guess, my own understanding of the need for self-care. And I implanted that, I guess, into the science of how the whole body connects. So my background is in psychoneuroimmunology, so the science of mind-body connection. And I wanted to really teach people in a very easy to read, easily accessible way to understand how it all interconnects. I think Western medicine is taught in this way that is hierarchical. The brain's more important than the gut is now more important than anything else. The gut's more important than the muscles are more important than the liver, etc. Like we have this kind of inbuilt, education, a thing of like, what's the first step? Where do we go? What's more important? And delivering this message of this holism, this whole person care is, it's challenging at first to understand, but once you start to understand this whole aspect of our lives and the importance of every aspect and how we piece it together and how we connect, then it's transformational in terms of our understanding of what we need, but also as members of the community too. So we can understand that other people have particular needs that are different to ours and that we're part of the matrix rather than all of the matrix. And I think that's really important message for healthcare practitioners, because there is a pressure of thinking that we've got the answers and we need to fix. Whereas I think what's missing from medicine is this ability to share stories and to see the importance of the narrative that comes through the expression of ill health. And so that's kind of where the book was born. And yeah, it's been really beautiful to see my patients and people, interpret it in their own way, which has also been, it's such a gift to have people own their own story through my story. And that's, I think, so powerful.
It's extraordinary, and it's such an amplification of everybody's well-being. I'm really having the feeling of, I know I'm talking to a thought leader because my mind's just been stretched in 5 minutes in about 8 directions. Now I don't know which thing to pick up. But certainly, I love this phrase of protected time. I mean, I think there's so much value in thinking about protected time. I hope that anybody listening to this little conversation will consider that in their own life. Did I used to have protected time, and how has that changed, and how can I now influence that? And this idea of transformation, that transformation comes through these kinds of conversations and being together and, stretching and testing and playing, and then actually just sitting together. And there'll be lots of opportunity for that at the heart of medicine, where there'll be time and space to really have our minds stretched by the conversations that we're having with our faculty, but also with each other as we're there in an international community, considering all of these things about how it makes a difference to be connected, to sit and really ponder ideas, to not be rushing. We know that time and time pressure is the biggest factor of empathy and compassion and connection. So just awesome to hear these ideas that you're sharing with us. Primary care is really under the pump in lots and lots of countries, and certainly in Australia and New Zealand and America, the UK, and lots of other places. Is there anything you'd like to share or say to our primary carers around the world as a part of conversation?
Yeah, I mean, it is under the pump, and I think it's one of the most unfortunate things. And in some ways, I don't know whether it has to be as under the pump. I think in many ways, it's the system and also the old system that we haven't had the courage to change yet. And I think as individuals, we can actually challenge that by allowing ourselves a little bit more time. And obviously, I mean, I'm sure there's lots of people saying, well, I just simply can't. I have too many people to see. but perhaps even like doing it one day a week, of having longer appointments for complex care. And for me personally, I really enjoy that because I do have time to sit with my own medicine and allow the story to filter through me. And it's a much more relaxing way to practice medicine because it does pull in from so many different aspects through our training. I also would say to primary care practitioners is trust your wisdom and trust your training. I think medical training is some of the best training in the world. There is something about it that is incredibly unique, and particularly in primary care and general practice, the role of the generalist is the role of the connector. And that is just what is missing in a fragmented, siloed system. So I think what I would say to all primary care physicians is back yourself, back your generalist nature, and back your ability for whole person care, because it is absolutely what is missing from the system and profoundly needed. And you guys are the experts.
Yeah, awesome. Well said. Here. And so just in closing, I wonder, we know that you're delivering these beautiful retreats, enlivened retreats in Bali, and you have one in May. So it would be very remiss of me to not point to that, because I think you have a couple of places left. So maybe if you just want to give a little plug to that before we say goodbye.
Sure. We've been running these retreats for a couple of years now, and the one that's coming up is called Wise Radiant Me. And it's really, I guess it's a highly curated retreat over 6 days to help people to really understand their own self-leadership. And we'll come back to self-leadership all the time and self-care. So this deep sense of self-worth that can come through the practices and through allowing the slow time and deep listening to our own body's wisdom. And they're amazing. I mean, they're one of my highlights of the year. We've got 2 spots left. And we go to a really beautiful place in Bali, which is away from all of the crowds, and share some time together, beautiful food, obviously massages and movement. But I think most importantly, a deep sense of connection is fostered. And what we've watched is people transform through that knowledge and wisdom and bring that back to, to really enrich and enliven their lives.
Okay, well, as you know, I'm coming one of these days. So, thank you very much for your time today, and we look forward to seeing you in Central Australia in 2026.
Oh, me too.